I'm Dr. Shrutika Junagade Kankriya, retinologist and cataract surgeon, Asian Eye Hospital, Pune. I have experience of last 15 years in treating retinal diseases. Now, this particular patient had complicated diabetic retinopathy with diabetic macular edema. He had been taking treatment from very popular and famous eye hospitals all over India. When he came to me, I meticulously evaluated his retinal problem. I started treating him with injections. We realized initially he didn't respond very well to injections, but we didn't stop. We tried other injections, we did retinal lasers, and what really made his treatment successful was the patient's commitment as well. This patient is a testament to the fact that continuous regular retinal injections plus retinal lasers and timely modification of injection and treatment strategy will give ideal or desirable results in anybody having even complicated diabetic retinopathy. Not only that, he also developed glaucoma through the treatment journey. We also started glaucoma treatment in the form of eye drops for the patient. That also worked very well. And finally, we could treat his diabetic retinopathy pretty satisfactorily.
I'm Shubhrata. I'm a retired person and I was working in Chennai, and I had a diabetic for last 20 years, and I had macular edema after diabetic retinopathy, and I was taking my treatment in Chennai, and during the course of time I had the injections which is used for macular edema, and also I had vitreous hemorrhages, and for that I had to go once for vitrectomy operation in Chennai. So when I was getting retired, I was quite worried as to what will I do when I go back home in Pune, and where will I do my treatment. So I took some which are the hospitals they provide these type of treatment, and then fortunately I got the name of Asian Eye Hospital, and the moment I reached Pune, I immediately went to Asian Eye Hospital, and I was eager to meet the doctor. The first day I met Dr. Shrutika, I was amazed at the way she has listened to the whole history. I could see the way she has given me confidence, and then one by one she started testing all the parameters, and then he gave me a brief picture as to what is the status now, and after that the whole treatment started. Within one or two visits I was getting enough confidence, and that this is the hospital what I was looking for, and fortunately I got the same hospital, this hospital in my native place. So after that the whole journey went on, and I think from 2021 till now I had several rounds of visits to the hospital for the periodic check, and she had given me treatment like laser injections and various other treatments which has finally restored the vision which it was deteriorating after some time, and now I think it is quite stable. And recently I was going through a type of injection, Vebismore, which was giving more better stability. So this overall journey, what I found, in fact initially I was quite worried on few things, like when hemorrhage takes place, I was worried one thing like retinal detachment may happen. So but she gave me the confidence that since we are doing the laser periodically, and then this status is such that this will never happen. So periodically doctor gave me a lot of confidence, and I feel like coming this hospital. Moment I see that it is just like my another home. The hospital has got its own plus points in terms of it's very clean. The whole discipline is very good. The people are very cordial over here. They explain things in detail. And as a result, what happens, you feel at home. When you come to this hospital, you feel like coming to the hospital. And then once you get your treatment, the whole throughput time is a very interesting thing to note. The time taken to enter the hospital and come out of the hospital is so less as compared to what I have seen in many of the hospitals when I was doing the same treatment. It really proves that the whole system is well established, and as a result we can come to this level of efficiency. This is point number one. Point number two is the diagnostic system is most advanced over here. With all these facilities, the instrument what the hospital is having, the machines what the hospital is having, it is really remarkable. And let me tell you, with a very nominal cost as compared to many of the places. So time, cost, and at the end of the day, value for money for the treatment. So as a result, I have now seeing there is a stability in my vision, and the hemorrhage part last 1 year it is there is nothing, no such cases, and I'm seeing a confidence that I can measure every day morning when I wake up. I can see the visibility of what is the change in my earlier status of vision and what is the change now. And I'm quite hopeful with this new treatment what we have started, and also some of the guideline what the hospital has given to me to follow those guidelines, and I'm sure we will be able to bring a stable. This will not be a curable disease, but this will be a very well maintained and very well treated sort of a approach, which will bring you a very comfortable way of living. So that's, I think, the result. The result, I would say, at some point of time you may have some apprehension, but you will see that mostly it needs to have more control from your side to get a better result rather than because whatever treatment I have seen, I have gone through the detail of that. Everything is the recent one. The recent research one is being applied, is being given to us, and that's the whole thing what I can say at this stage. Thank you for giving me the opportunity to talk about this hospital, because let me tell you one thing, after I started coming to this hospital, many of my friends has also got convinced and they saw my progress, and they also started coming to this hospital. And this is a wonderful journey for me. It's a very difficult issue to handle, but it was handled well by this hospital.